Let's talk about how long you need to be on hormonal therapy. Before I go on, I'd love to invite you to subscribe to our channel. We're always putting out new content. We have a really big library about endocrine therapy you can watch, and new videos mean you always have something new to watch. I'd also love to invite you to go to Yerbba.com and get your personalized Yerbba report. There you will learn about the different treatment options for you specifically in terms of endocrine therapy and how long you might be offered endocrine therapy. So endocrine therapy, also called hormonal therapy, is also called anti-estrogen therapy. And whether somebody is on an aromatase inhibitor or tamoxifen, these drugs work by decreasing the dance between estrogen-positive breast cancer and estrogen in your body. People with estrogen receptor and or progesterone receptor positive breast cancer, called hormone receptor positive breast cancer, those cancer cells are, if you will, encouraged to grow by estrogen in the body. And even after the ovaries stop working, even in people without ovaries, the body makes plenty of estrogen. Tamoxifen works by blocking estrogen from getting to the estrogen receptor, not just in breast cancer cells, but other places of the body. Originally, tamoxifen was tested for 2 to 3 years, then compared to 5 and then to 10. And studies have shown that for most people, 5 years of tamoxifen is sufficient, but the ATLAS trial, which stands for Adjuvant Tamoxifen Long Against Short, showed that 10 years of tamoxifen was even more effective than 5 years of tamoxifen in some people. So depending on who you are, your risk of recurrence, why you're taking tamoxifen, and whether or not there are other options, you may be offered tamoxifen for anywhere from 5 to 10 years. Aromatase inhibitors are given anywhere from 5 to 10 years as well. The MA.17 trial showed that in people with higher risk disease, bigger tumors or positive lymph nodes, 10 years of therapy gave additional benefit over 5 alone. Why is this the case? Why would more therapy be better than less? Well, remember that hormone receptor positive tumors are more slow growing and that they grow when estrogen reaches that estrogen receptor, and that these aren't, hormonal therapies don't kill the cancer cell, rather they starve the cancer cell. And starvation takes a lot longer than chemotherapy, which you might think of as more like, forgive the term, assassination. Starvation just takes longer. The longer you deprive any cancer cells in the body, whether they're elsewhere in the body or in the breast tissue, the better. Because the longer they starve, the less likely they are to wake up again and cause trouble down the road. So longer therapy is better. Now, this doesn't mean that shorter therapy is not helpful. For people at high risk of breast cancer, without breast cancer, 2 to 3 years of tamoxifen may decrease their risk of developing cancer in the future. The benefit of longer therapy is based on the risk of recurrence. So people with a higher risk of recurrence are going to get greater benefit with longer therapy, just because we want to give absolutely everything we can to that person who's at higher risk to decrease the risk of the cancer coming back. If you have been told that 5 years of endocrine therapy is sufficient for you, it's worth asking your medical team, would additional 2.5 years, an additional 5 years, either of the same medication or of a different drug, so let's say you're on tamoxifen, would an aromatase inhibitor give me additional benefit? Or if you're on an aromatase inhibitor, would additional therapy with tamoxifen give me additional benefit? This is very personalized. It's not something that we can tell you in a video that this will help you without knowing the risk of recurrence, which in turn is based on the tumor size and on the lymph node status and other things about your tumor. So I want to invite you again to go to Yerbba.com to get your personalized report where you can learn more about the ideal duration of therapy to you. Then a really important note is if you can't tolerate endocrine therapy, longer therapy may not be in your best interest. If you feel miserable on a particular medication, switching to a different medication or being on medication for less time than originally planned needs to be part of the conversation with your medical team. We can't just have what I call oncovision, where the cancer is the most important thing. We have to treat the person. So if you're really experiencing a lot of side effects and your quality of life is negatively affected, switching to another medication, even before the planned duration has been complete, is something that is an option to you. You're not stuck on one therapy if you feel miserable. So let's come to you now. You're on this medication. For people, I'll tell you, for people who are not on endocrine therapy, they feel deprived. They say, I don't have anything else to help keep the cancer from coming back. People on endocrine therapy are like, oh, I have to take endocrine therapy. So it may be helpful to reframe it that this is another option I have, not I have to take this medication, but this is an option for me to decrease the risk of the cancer coming back, and I will work with my team to find a treatment I can tolerate. So I don't want to tell you you're not thinking about this the right way, but sometimes that frame shift can really help. You'll want to think about this as an added safeguard on top of everything else that you've been through to decrease the risk of the cancer coming back. Try not to think of it as something you absolutely have to do. The more you can think of it as something you're choosing to do, the more your own agency can be heightened and the more you can feel like you're driving your own care. The other thing to do is stay in really close touch with your medical team about your side effects. If you don't tell them you're having a side effect, they're not going to know that a change needs to be made, whether that's adding another medicine to help with the side effects, tweaking, changing the medication you're on, or even changing the time of day that you take it, or introducing other non-medical interventions to help with your side effects. So stay in close touch with your medical team to make sure that the duration of therapy works for you, not just in terms of the risk of recurrence, but also how you feel every day. I've covered a lot. Again, go to yerbba.com to get your personalized report to find out, will endocrine therapy be part of your treatment plan, which ones are available to you, how long you might be on them, and what to do if you're not tolerating your current medication. Thank you for watching, and we'll see you next time.